Good afternoon, everyone. This is County Executive Pat Ryan. Thank you for joining us. I hope everybody survived whatever happened this morning weather-wise, whether it was a monsoon or a tsunami or whatever we call that. I know it was wet out there, and I hope everybody made it through. It's a little bit brighter out now anyhow, and I hope you're enjoying the day. We're going to cover some public health updates, and then I'm going to talk a little bit about some of our recovery efforts, and then we'll wrap up. To start off, we'll start with the data. We continue to look good, and all signs are encouraging as we're now in our third day of phase 2. So we continue to feel, so far, knock on wood, good about how that is going. We have had cumulatively 1,770 positive COVID cases, but that is out of over 23,000 residents that have now been tested. 83 fatalities over the course of the period of COVID, unfortunately. However, 1,248 recovered. So obviously we want to continue to see that recovery number go up and up and hope that the fatality number holds steady, of course. In terms of hospitalizations, we are still at that same level we've been at of 7 individuals in Ulster County hospitals, 1 still in ICU. Active cases, we are each day seeing this number go down, thankfully. We are at 439 active cases right now. And again, as a reminder, at the peak, as you can see on the graph, we were over 1,000 active cases. So we're less than half of where we were at the worst of this, and continue to see that downward trend line there. More good news when it comes to where we're at with testing and new positive cases. We continue to have record numbers of tests being completed, thanks to our robust testing efforts across 4 different sites. And now we're also seeing some individual physicians and practices start to offer more testing as well. So among all of those, our testing numbers go up and the positive cases are going down. In the last 24 hours, we tested 711 residents and only had 3 positive cases out of those over 700. So that's an even lower percentage than at our last update. This is the number that I am most focused on, this and the number hospitalized. And so to see them continue to stay very, very low, almost this number in terms of new positives, almost at 0, that is very encouraging. As we reopen, particularly with phase 2, and as we start to see the impacts of phase 1, this is really the number and the metric to watch that we will continue to watch very closely, both in terms of tests done so that we know that we continue to test widely, and in terms of the number of positives, which we want to remain low or ultimately get to 0. It'll be a good day. It'll be a very good day when we actually have a 0 come in terms of new positives. We haven't had that yet, but we are getting close. Hospital capacity, as I said, we are at 7 right now, 1 in the ICU. We retain more than sufficient capacity among our Ulster County hospitals. And as always, I want to thank them for everything they've done on multiple levels to help us get testing up, to deal with the influx of COVID patients, and to do all the other things that they've done to keep us all healthy throughout the crisis and beyond. So thanks to Health Alliance of the Hudson Valley, thanks to Ellenville Regional Hospital, thanks also to Newvance Health that has partnered on our testing site and also serves some of our residents over in Dutchess County. So those are the relatively brief public health updates. Again, I think if we take a step back and think about where we're at, we are now well past 2 weeks since we began phase 1. So we're just at the point where if we were to start to see resurgence, right around now is where we expect we would see it. So again, we're watching very closely, but as of today, we still look very good there. Phase 2 continues to go very well, and I think that's a credit to all of you and to all the businesses that have done the work and done the preparation. It's a credit to our economic development team that's been working with businesses around the clock to help prepare those safety plans, to make sure workers are ready, and to make sure customers and consumers are feeling rightly safe as they get back out there and frequent our businesses. So I know a lot of people have been enjoying particularly the outdoor dining part of Phase 2 and also the haircut part of Phase 2. I have not done either of those yet, but hopefully soon, hopefully this weekend, we'll get both of those done. So when we think about our overarching economic resilience plan, which is the three-phase plan to recover, reopen, and realign our county, all those things are now really happening in parallel. We started, of course, with our immediate recovery efforts to help our businesses, to get them cash, to get them capital to keep their doors open and keep their workers employed as much as possible. We also worked very hard, and we'll talk more about this, to help all of our individual residents and families in terms of meeting food need, housing need, mental health need, and so on and so forth. Of course, we've been doing the reopening, and we also continue the medium and long-term work in thinking about how we're going to realign our economy. What should that look like a year from now, 10 years from now, 20 years from now, and 2040, so that we can hopefully learn the lessons of what COVID exposed in terms of inequalities, inefficiencies, and opportunities to do better in our economy now, and really take those lessons to heart. So we're doing all that work in addition to managing, of course, the public health aspects of everything going on with COVID. What I mostly want to talk about for the remainder of the time we have today, which I promise will be brief, is specifically the recovery efforts and what we've done and where we're going with this, because I think this is a really exciting point in terms of learning from how we responded to the COVID crisis and carrying those lessons forward into a broader recovery approach for the county. So what do I mean by that? To look backwards for just a second, if you remember back in March when we started to have our first cases of COVID, one of the first decisions we made, and I think a right decision absolutely, was to set up a COVID-19 hotline within our health department, but staffed by members across our county workforce and even many volunteers who graciously volunteered. And the whole idea behind that hotline was, in a moment of crisis and confusion and lack of information, we needed to have a single place where our residents could call, could get information, and ultimately get help. They could get answers about COVID, they could get tested, they could get access to other critical needs. And early on, our COVID-19 hotline was consistently we've been getting hundreds of calls a day, but early on, most of the calls were about COVID. How do I stay safe? Who's at greatest risk? Where can I get tested? How does COVID spread? Those sorts of questions when we all didn't know as much as we do now about COVID. But over time, what we saw is, as we started to get the public health aspects more under control and got our testing set up and so on, we still got as many calls. We actually started getting more calls, but they were different. We were starting to hear a different set of needs as we shifted from taking care of people's health to taking care of their broader recovery needs. So first, we heard a lot about food. As people were being laid off or furloughed and losing income, of course, families were worried about putting food on the table. So we stood up Project Resilience and used the hotline to help point people to that direction. We started hearing about housing needs and threats of eviction from landlords. We started hearing about mental health issues, substance abuse issues, loneliness, a whole host of challenges that many residents were already experiencing before COVID as well, that were made even worse by the crisis. And so as we look forward, one path would be, we feel pretty good about how COVID is going. We can shut down the COVID-19 hotline. But I think the other path, which we're excited to take, is to actually say, let's not only keep this going, let's actually expand the mission of what was initially the COVID-19 hotline, and we're actually going to launch it and expand it as what we're calling the Ulster County Recovery Service Center. And so what that basically means is we'll keep this line up that's staffed by county staff, and we'll also have a 24/7 online virtual chat function so that 24/7 anyone in the county can reach out and get help on a set of services, and we'll talk about those in just a minute. But the idea here is that, one, we're going to see the needs go up and up and up due to the economic impacts of COVID. And two, I recognize that sometimes navigating what can feel like a maze of different county departments and services and programs and forms is difficult, and we need to and want to make that as streamlined as possible. So this Recovery Service Center will be a single phone number, a single website, a single place that all the residents of the county can go and reach out and get those answers and get that help in the same way that the COVID-19 hotline provided those answers and that help. So our county innovation team, along with many other departments, our IT and technology department, are doing the work now to get this ramped up and expanded. And we're now at the point where we're ready to launch this Ulster County Recovery Service Center. And I want to tell you really a little bit more about not just why and how we got here, but now what that's going to look like for you all. So we have at least some high-level points on a slide, and I'll talk a little bit more about them. But basically, the Recovery Service Center is designed to assist all of our residents in pre-screening or applying for all the different social and economic programs we have, and it'll provide 24/7 single point of access to county government and to all of our services. Think of it as sort of the one-stop shop, the one number you need to call, the virtual or metaphorical front porch, if you will, where you can come and kind of get access to all the different parts of county government. And we're starting with a set of services that we think that we actually know from the data, from the calls we're getting inbound. These are the services that we're most hearing people are needing right now. So we're starting there, and the goal is that we'll expand this more and more over time as we hear different needs from folks. So what are those services? This is a high-level list of the different services that we'll be providing through our Ulster County Recovery Service Center. Food assistance, housing assistance, mental health support, employment assistance, meaning those that need help trying to find jobs or that might need skills training or different access to training and workforce development services and employment services. Business assistance, so any of our businesses out there that are still navigating what I know is a complex process of reopening, as well as needing access to loans, state, federal, and local, and just general business support services. You'll be able to get those through the Recovery Service Center. And of course, we'll continue to maintain our actual COVID-19 public health assistance for anyone experiencing or having questions about COVID-19. So again, I think it's important to recognize for the last 3 months, the Recovery Service Center has really just been focused on that bottom bullet of COVID-19. So this is a major expansion of what this team will be doing. And I hope it results in a better and really a more responsive experience from the government to all of our residents. This is something that we were planning to do in some form or fashion anyway, and I think honestly the crisis of COVID just catalyzed us to move even more quickly to meet the need. And I am concerned not only about a potential reemergence of COVID, but the economic impacts of this, as I talk to families across our county, has just already been devastating. I mean, we know the unemployment numbers are well into the double digits now. We know how many people have been affected and how much pressure is being put on the shoulders of families and working folks across our county. And so the goal here is to be there for you, not just during the immediate COVID crisis, but afterwards as we go into this next phase of our recovery efforts. So please spread the word about this. We'll be talking more about it and sharing more information, but we're very excited to do this. And it really goes back to one of my original big 5 priorities I outlined almost exactly 1 year ago when I took office, which was to make county government more responsive and responsible. And this is right up that alley where we realized that we could take the way we operate in a crisis and carry that over to our more normal business and hopefully provide a better and more responsive experience for you all. So please use those services. Let us know how it's going. We're just starting this. I'm sure we'll make adjustments and need to make adjustments, and that'll be based on your feedback and your input. So don't hesitate to reach out and let us know. The contact info, which is probably important here for the Recovery Service Center, it's also will be prominently on our website and so on. But feel free to share. It's the same phone number from the COVID-19 hotline, so it's 845-443-8888, 443-8888. It's linked right on our COVID-19.ulstercountyny.gov website that I hope you frequent, that has our dashboard and all of our other resources. And if you want to directly email the Recovery Service Center, you can see the email there. It's just rsc@co.ulster.ny.us. And again, please let us know how that's going and how the experience goes. I particularly want to thank and recognize, I won't do it by name to embarrass them, but there's about a dozen current members of our county workforce that are staffing this hotline, and there are dozens that have done one or more shifts over the course of this crisis staffing our hotline. And I think this is some of the most important, impactful work that you can do as a public servant to really be on the front lines of this crisis. And I want to thank all of our members of our Ulster County team that have been doing this work and really directly engaging with all of our residents to take care of them. And we're going to take many of that same team and keep them on to work our Recovery Service Center and to really liaison with all of our other departments and be that single point to connect you, the residents, with these critical services in a time of need. So thanks to everybody on Team Ulster County that's been a part of and will be a part of our Recovery Service Center. As we wrap up, just to shift back to where we're at as a county, again, phase 2 is going well, but how well it goes absolutely depends on each one of us following the guidelines that we now know and the science proves matter, which are wearing a mask, maintaining social distance as you're out and about, and of course, hand washing, hand sanitizer, making sure that you're following through on those and doing that as often as you possibly can, especially once you're coming into contact with others or you're at a store or a restaurant or whatever the case may be. We know that each of our individual actions absolutely have an impact on others. We saw that at the worst of this crisis, and we need to keep that in mind as we go forward. And I ask you all to do that as you've been doing. It's too early to tell, but there has been some public media reporting of numbers in other parts of the country and other parts of the world that have reopened ahead of us, that there may be indications of some increased numbers. It's just too early to tell, but I do want everyone to know that we are watching that closely. Our health commissioner is watching that closely, and that's what we're on the lookout for here. I think the difference, though, is how committed folks are to, as we reopen, doing it safely and following through on these guidelines, which I know are can be an inconvenience, but which absolutely make a difference. So again, I ask your help and appreciate your help on that. Finally, as we wrap up, just an update on Project Resilience, continuing to go along very well. Delivered over 230,000 meals delivered and provided, and that work continues. So thank you to everyone that is a part of that. And again, if you need access to that, that is one of the services that you can access through our new Recovery Service Center. And finally, as we always do, just to end with a thank you. My hope is that if you remember the sense of how things felt in our community here, even just a month ago, 2 months ago, when we were at the worst of this crisis, where I really felt at least this cohesion, this sense of community, this sense of togetherness, and we're all in it togetherness. And that was all really driven by this appreciation for all those that were putting themselves at risk for our greater collective good. Our healthcare workers, our grocery store workers, our first responders and law enforcement professionals, pharmacy workers and teachers, and so many others. And my hope and my plea is that I know that there's a lot going on, but that we can keep that sense of community and connectedness as we come out of this crisis, that it doesn't take a crisis to drive that sense, but that we on our own can decide as a community that we are going to keep that spirit going. And I know that so many of you are doing this right now, and ask that you keep that flame going and that sense of connectedness and willingness to give a little bit to take care of those around you. That's what I know growing up here always made this place special, and that's what kept us going and allowed us to weather this crisis. And that is what is going to allow us to come out of the COVID-19 crisis smarter, stronger, and more bonded. And so I know there's all sorts of reasons and things that could pull us apart and bring us back to out of that framework. But it is incumbent on each of us to not let that happen. And so I ask your help in that. And it starts again with thanking your fellow frontline workers and neighbors and just everyone that's stuck together through this. So again, from me and my family, thank you. We will see you again for an update on, let's see, today's Thursday. We will see you on Tuesday at 2 p.m. As always, reach out if you have any issues, and particularly don't forget to reach out to our Recovery Service Center. That number is 845-443-8888, and you can see the other contact info on the screen. Thanks to the whole team that makes this production happen, Radio Kingston, our sign language interpreters, our Spanish language interpreters, and the whole team that helps make this happen behind the scenes. So hang in there, be resilient and healthy, and we will see you next week.